Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 21st of June. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bykowski, who's a student researcher with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great, thank you.
I'm going to start by sharing my screen. This is the reported cases in Illinois. Yesterday, we saw 54,000 positive new cases in Illinois with a daily average of 96,000 positive new cases. And here are this 14-day average numbers. So with our testing positivity being a 14% increase, with hospitalizations increasing by 3%, and the death rate has increased by 17%, and the ICU has also increased by 9%. And in Illinois, we are seeing a 7% decrease in hospitalizations, with cases being with a 7-day average of about 3,000 positive cases, nearly 4,000, and the death rate being 49% increase. All right, Dr. Murphy, what can you tell us about these numbers?
The numbers show is that the overall cases are coming down. No matter how flawed they are, they're decreasing. So that's good. And remember, this thing is always sequential. So cases, weeks later, some people get sick, hospital. Some people then end up in the ICU, some people die. So, it's the whole, you have to look at the whole spectrum. So now we're seeing the cases go down. So that will translate actually into fewer hospitalizations and deaths. You have a little bit of uptake in the deaths right now. And the hospitalizations, but it's at such a low level that I'm not sure how meaningful those numbers are. And then it depends on how big the average, the time span of the average is. Is it 1 day, 3 days, 1 week, 2 weeks? There's all different ways to look at it. So in general, a nice summary was just done, I think in the New York Times, and cases have increased about tenfold overall. During just most recently, and the number of deaths per case has dropped threefold. So that means that the infection has gotten milder, and or people are more protected because they had COVID already, they had the vaccine, or they had both, which is even better. So virus exposure, vaccination rates, booster rates, all that stuff comes into play. So we're at approximately, depending, I'm not sure what the time frame is, they looked at 341 deaths per day. In your table, you had 311. So that must be a shorter period. You're looking at a closer snapshot. But anyhow, that's 2 times the suicide rate, 2 times the car accident rate, and 3 times the flu rate. So it's still problematic. I mean, I don't think we need to rest. And this is the general term that's being used is community immunity. And that's why the protection from severe disease has gone down. Now, then if you look at the people who are dying, you've got a lot of people who are vaccinated are dying. The last number I had seen was 42%. So the unvaccinated still do worse. But the cause of death has shifted from COVID pneumonia to whatever the underlying conditions, medical conditions that the people have. So, heart disease, neurologic problems, stroke, whatever. They're dying of the COVID is like tipping them over the edge, for the underlying diseases that they have. So that's a general movement. So all this is just pointing in the direction that we've got a change going on in the pandemic. And that's all good news. It remains to be seen what happens with the next wave. There'll be another wave because there's new variants, BA4, BA5, and who knows what the next ones are. So we'll see what that is. The death rate was high in Omicron, not so much because of Omicron itself, but just because there were so many people infected. And you're going to see big regional differences too. Regional differences based on vaccine and how many people have been infected. But there's very few pockets left in the United States and the world where nobody's been exposed and nobody's vaccinated. So those people have all gotten infected or they got vaccinated. So it's kind of good news, but you have to put it into perspective. It's still over 300 deaths per day.
Yeah, absolutely. And, going into our first headline, Dr. Murphy, which will hopefully help decrease the death rate in severe illness, is that the vaccine was approved for young children. What can you tell us about the side effects, the efficacy, where to get shots, etc.?
So kids under 5 were the last group of 18 million people in the United States that have been vaccinated and protected. So it's the last pool of people that can keep the pandemic really going. Now, supposedly 75% of those kids have already been infected. But remember, having natural immunity actually is not as good as the vaccine immunity, and having both actually is better. I'm not that you want to try to get infected or anything, but that hybrid immunity is actually quite potent. So what about the vaccines? So the studies have been done for both Pfizer and Moderna. Pfizer's a 3-shot series. The first 2 shots are 3 weeks apart, and the second one is 2 months after the second one. Each dose is just 1/10 of the adult dose, and very safe, and it shows a nice immunologic response. Matter of fact, it works great. 80% of the children from 6 months to 4 years old were protected by the vaccine. Moderna's is a 2-shot vaccine given 4 weeks apart, just like with the adult. Each dose is 1/4 of the adult dose. The efficacy data with the Moderna virus in this age group was less, only 37 to 51% effective versus the 80%. So there's a difference in the Pfizer versus Moderna. Now, they didn't get tested head to head. There were separate pools. That's how this thing was done. And so, Moderna is effective. And it's interesting because in adults, it seems like Moderna is has improved efficacy in some adult populations. Regardless, you get a benefit, and both of these were approved.
Dr. Murphy, can I ask you a question? If Moderna has such a lower efficacy rate, why shouldn't parents just vaccinate their child with Pfizer? What's the argument to vaccinate their child with Moderna?
Well, it's 3 shots versus 2, so it is a little bit more cumbersome to get the vaccine. Frankly, I would pick the Pfizer if I had a kid under 4. My kids are older. My grandchild is just turned 6. So she's already was eligible under the other EUA, the emergency use authorization. But yeah, if I had a choice, I would take the Pfizer vaccine.
Okay. And now for our second big headline, one that's a little bit more frustrating, is that Florida is the only state that, as a state, hasn't ordered vaccines for kids under 5. What can you tell us about what is going on in Florida?
What's going on in Florida? It is just, I don't understand why anybody would want to go against all the public health authorities, basically in the world, all the pediatric associations and regulatory bodies and major pediatric hospitals. Why a political decision we made not to order the vaccines. Now, they're not banned. All right, but this is just political posturing. Hospitals can still order the vaccine, but they have to do it individually. It's not going through the state. And so I think if you really want to have the vaccine in Florida, you can get it, but the state is making it more difficult. And they're making this anti-COVID vaccine statement. I'm just, it just puzzles me. I can't explain why anybody would want to put even young people more at risk. Yes, kids do pretty well with COVID, but we don't know about long COVID in kids yet. Still kids get very sick with COVID, and still children end up in the emergency room, the hospital, the ICU, and they die more than from the flu. So, how many kids do you have to kill by your negligence in not vaccinating them? I mean, many vaccines are mandated by daycare centers and schools, that the kids have to have their vaccines up to date. And that's to save everybody, save them, save the other school children and the staff from getting infected. So to me, it just doesn't make any sense. And it's just a political move and not a medical move. And it's bad public health.
Yeah. And now going into our third headline, Dr. Murphy, is Omicron may be less likely to cause long COVID than prior variants, a study is now suggesting. What can you tell us about a British research that has been done about this?
Yeah, this is an interesting study published in the Lancet. So the Lancet is like worldwide the top, or one of the top medical journals. Published in the UK, very reputable. And they looked at a study called the Zoe COVID study. And you had to have a smartphone app. 4 million people signed up for this thing. And what they do is on their app, they put their symptoms after they have COVID. I don't really know any more of the details than that. Then they define long COVID as continuing to have symptoms at least 1 month later or longer. So they followed them, and they looked at a group who signed up during the Delta wave. This was before January 1st. Matter of fact, it was from June 2021 to November 2021. And then they compared it to a group from December 21 to March 22, when most of the cases in the United Kingdom were Omicron. And they found that the symptoms reported a month later, so it could be 1 month, 2 months, 3 months, because remember, that's not that long ago, March, it's only 3 months ago. So they don't have really a long follow-up. However, the symptoms were much less in the Omicron period. And I mentioned this a little bit earlier, that it seems like it's a milder disease and fewer hospitalizations and all that comes into play. But it was 11% versus 4.5% in the Omicron period, 11% in the Delta period and 4.5% in the Omicron period. So it's approximately 50% less. And if you were vaccinated, it was even less. Now, there's all sorts of statistical study design problems with a study like this. It's voluntary. People are signing up on their own. That doesn't mean it's not of any value. I think it fits with the other data. And so I think that's great. And, I think you're going to see more studies like this following, really 4.7 million people. I mean, that's a lot of people signing up on this app, and they're seeing a difference here. Now you have to really dive into it and see how many people followed up at all, who didn't follow up. And, there's all sorts of other things that happen. Maybe also people in some of these studies using smartphones, they get tired of doing it. Do they just drop out, or, whatever, all that stuff comes into play. This is not randomized or anything. It's just an observation, but it's a huge observation, and it kind of fits with everything else that's going on. So I think it's just another chunk of data in the whole pool of data that we have that shows that maybe Omicron is a little less severe.
Very interesting.
Okay.
Now, Dr. Murphy, for our first COVID question and our only COVID question is, how long does immunity last? Will a second illness be worse? How can I prepare?
This is a great question. We don't really know because mostly on a population level, all we're measuring is antibodies. And we know that antibodies go down after a period of time. But there's another whole part of the immune system called the cellular immune system, T cells and, memory cells. These things kick in after you're exposed to the virus for a second time or third time or whatever. And they take about a week to get activated, but they tend to keep the people out of the hospital and prevent severe disease. So we don't know how long that lasts. That could last for a long time. And it may be why we're seeing this death rate now, because so many people have had COVID and so many people have vaccinated, and we have this community immunity. We don't know. But right now, the second illness typically isn't necessarily any worse than the first, and oftentimes is milder. And that's for two reasons. One is the immune system is fighting it better because it's all revved up. And the other is that the variant that's out there is milder, like Omicron compared to Delta. Delta was bad. So, let's hope the next variant that comes, and there will be other variants, continues to get milder or the same and doesn't get worse like Delta got worse. So, we have to be vigilant and keep our eyes open and keep studying this and look at these variants as they come up. Probably change the vaccine somewhat. In the fall, we're going to have a new version of both the Moderna and Pfizer vaccine. It's going to be a mixture of the new version and the old version. Just like we change the flu vaccine every year, it's going to be something like that. But this immunity, it's very difficult to measure other than just antibody levels, which don't help so much. And the goal is keeping people. Now the goal is just to keep people out of the hospital and keep them alive. So it's preventing cases is going to be very difficult.
Absolutely. Well, Dr. Murphy, those were all of our COVID questions for today, and we will see you next Tuesday. Thank you very much, everybody. We'll see you next Tuesday.
See you next week.